And now I have the special honor of introducing our keynote speaker tonight. Dr. Tracy Frech is a trailblazer in the search to better understand, treat, and eventually cure scleroderma. Dr. Frech is an associate professor of medicine in the Division of Rheumatology and Immunology in the Department of Medicine of Vanderbilt University. In fact, just last week, it was announced that Dr. Frech will be chairing the Division of Rheumatology and Immunology starting in September. She will be the new division chief. Congratulations, Dr. Frech. Dr. Frech's primary goal in research and clinical care is early diagnosis and effective treatment of systemic scleroderma. Please join me in welcoming our keynote speaker this evening, Dr. Tracy Frech.
So I want to start by thanking the foundation so much for this opportunity to speak on the Keynote platform for the opening of our National Scleroderma Foundation meeting. This meeting is one of the most important parts of my year, and I'm really very honored to be here with you all. And I thought the best way to maybe frame a keynote is to think about what we hope to achieve this weekend. We want to really highlight the importance of our scleroderma community. And in particular, I thought about this concept of rebuilding. And I have no conflicts of interest, though I will admit I absolutely love everyone in this organization and can't think of a better group to work with. I had a patient tell me that getting the diagnosis of scleroderma is a little bit like hearing a tornado's coming. There is a whirlwind of different things that are going through your mind and your body, and you start the journey mostly with fear, almost like a weather event where you're scared of what is going to come. And then as the symptoms start, and as you start to experience anything like reflux or shortness of breath, or even not sleeping well, you start to get anger and fear and frustration because you're worried that those symptoms aren't going to have treatments. You're not going to be able to be back to how you used to feel. And in particular, what the key of trying to battle these feelings is even if you're starting to feel better, you start to have guilt because your community, all the folks that you're with in your local chapter are not feeling well, and you're trying to come together and get a sense of how do we move as a community into a better place? How do we understand this diagnosis, and how do we feel better in the long term? And that's in fact what brings us here today. We want to understand how are we going to rebuild how you're feeling? How do we get the tools in your toolbox so that you can start to work towards redefining how you feel every day? And that's what I think we should probably approach this weekend. There's you're here to meet other people, to learn the tips that have helped other patients, to come together and meet specialists, and hopefully get some answers for some of the symptoms you're experiencing. And then you want to bring that back to your local chapters. And the foundation is terribly important for doing this well. So the National Scleroderma Foundation works tirelessly over an entire year to put the tools in your toolbox, to get you information on resources, medications, screening, risks, and really how they put the specialists together in the right room with the right patients so that everyone leaves feeling empowered with knowing how to use the different tools that are provided here this weekend in building upon the strong foundation that's essential for moving forward. And I'll highlight that nutrition, sleep, mood, and exercise play a critical role for how well treatments work. And so they tirelessly also get sessions on movement and try to get you the right educational tools so that you can move your care to the next stage. So as you're here this weekend, we hope that you will build your toolbox of knowledge. And I think there's some key principles here. The first is no one knows your body better than you do. And so as you take and you record the different informational sessions, tips, make sure that when you take those back, you record how those interventions make you feel. Try to reflect on the past 24 hours, what went well, what could be better. keep a diary about how you're sleeping, your exercise is going, how your mood and diet are going. And in that diary, what is helping you, what is hurting you, what's giving you peace, joy, and hope, and what can you do differently to make the next day better? And so all the tools you're going to gather this week and all the information really come down these fundamental concepts of how is your foundation going and how can we build upon the tools that are given to you. Now, one of the things in our new patient packet is this self-care plan. And the self-care plan was developed by a social worker I worked with who said, we need to think about not just getting into a visit and reviewing things quickly and trying to get screening tests done and then on to the next patient. Let's really try to understand what is center to health. And it breaks down, the self-care plan breaks down health into 6 different categories: physical, psychological, emotional, spiritual, relationship, and workplace and professional health. And I think those are good concepts that we're going to walk through. And the important thing about a self-care plan is you're going to think about the overall balance, what possible obstacles you have, what negative behaviors are causing these different realms of health to not be where you'd like them. And if you implement change, what positive effects can you do? What is, if you come here to this conference, you've been given a tip and you implement it, how is it impacting each of these different realms of health? So maintaining your highest level of physical health will help increase energy, which in turn will aid you in meeting your daily commitments. There's this concept that if you're moving and you're producing endorphins, you will feel better. But stated more simply, it's just trying to lead a healthy lifestyle. So making good choices and trying to exercise regularly within the physical limitations you may have. And that means even stretching every day, taking time to do that, moving your joints, and trying to get your heart rate up in a positive, healthy way is good, and something that everyone should try to focus on and record whether you're feeling better with that change. Now, this is important because sometimes your medications may not make you feel very well. And so if you're unable to exercise or move because of the medications you're taking, make sure you're having that conversation with your doctor. If you're taking your vasodilators for your Raynaud's and it's making you feel dizzy, try to identify the time of your day that you can exercise and get the most benefit from physical activity. Develop good sleep hygiene. So this means that, of course, there's many things that are difficult with our medications that don't make you sleep well. If you have to get up in the middle of the night to use the restroom. But try to talk to your physician about all the tools that you could perhaps use to get your sleep a little bit better. Whether it's a wedge pillow, whether it's changing your meal time so you're not eating so late, minimally, or changing the size of the meal so you're not having as much reflux, but really trying to figure out what helps you sleep better. Because if you sleep better, you'll feel more energized the next day. Following a healthy diet is critical, and this is important because remember, there's no single diet for everyone. Green is good, fresh is best, but trying to figure out what makes your GI tract feel better is critical, and working with a nutritionist may be necessary to get there. And then lastly, developing and maintaining your goals for care is really important. And communicating what's working well in your physical health at your visits is a component of keeping you well. And I highlight this picture here as a shout out to the Scleroderma Foundation. So raise your hand if you did a walk or a run in the month of June to support the Scleroderma Foundation. And I want to highlight everyone to give a hand of applause for everyone who went out there and tried to raise money by exercise for our foundation. That's awesome. What you do matters, and it really helps the foundation support all the amazing research that's being done. So I want to take a moment to thank everybody. Moving on to psychological health, this refers to your attention span, your memory, your ability to formulate opinions, your decision-making skills, and your thought processes. And psychological health is a really hard concept because it's really focused on positive thinking. So it's being determined to remain positive. It's important, though, that you realize you can't go at 120 miles per hour and keep a positive outlook. So you have to sometimes slow things down, give yourself small breaks throughout the day to try to process the different parts of your disease that are slowing you down and making you frustrated. It's natural to feel frustrated when you can't do the things you want to do. So give yourself small breaks, schedule times to relax, put it on your calendars if you need to, and take the time to engage with family and friends who are positive towards and supportive of you. And that's really important. So all the caregivers in the room, you should all make sure you understand how important you are on this journey in staying positive and reassuring your loved one when they're not feeling good. And by the same token, if there's things in your life that add stress and are unnecessarily causing you psychological harm, set boundaries and limits around this. And this is oftentimes in the form of work. So work emails, phone messages, things that stress you out. Take the time away from your job to focus on your psychological health. It's critical for wellness. Participate in a hobby, and this is my shout out to the yogascleroderma.com. So guided relaxations, meditations, breath work, really important for us as a community to identify things. Absolutely, everybody cheer, I agree. Take time to really engage in meaningful psychological health that are also hobbies and are good for you on multiple levels. And then identify and use effective problem-solving skills to try to stay positive. It's hard but necessary. Now, psychological health is different than mental health, and that's my segue. Usually when you can't stay positive, it's time to plan and take a vacation. So I congratulate everybody who got out here away from their work, because this is a good place to vacation. Now, what about emotional health? So emotional health is different than psychological health because this gives you the mental fortitude to deal with emotions on a regular basis that are not all positive. So there are times you're going to be frustrated and down and depressed, and that is normal. That is part of our journey together. But it allows you to do so in a way that's safe and appropriate. And so just be mindful of when you're having a bad day. And it's okay to have a bad day, but that's really when you're going to want to reach out to the people that can provide you the support and help you. Start a journal. Make sure that you're recording how you're feeling. And if there's themes to that, things that are really affecting your emotional health poorly, make sure you're discussing that both with your physician as well as your loved ones to try to get you in a better place. That's important to develop and utilize your support system. Oftentimes, when I talk to patients, when a loved one is out of the room, they talk about how they're always trying to put on a stiff upper lip. They're trying to stay positive for their loved one. And then if I ever talk to the spouse, if the patient steps out to go to the bathroom, the spouse is saying, I'm trying to be really supportive. And so everyone usually is in the same place, but they're not having the conversations and how to do that effectively where emotional health is protected. So just make sure you're talking to folks about how you're feeling and how this disease is affecting you. And that's a great use of your support groups. So talking to other patients that are experiencing what you are and building those friendships to help you is a valuable part of our organization. Learn to take deep breaths. And again, another shout out for the yoga and breath work. Take regular walks, especially when the weather's lovely here. And this is one thing I really try to do and that I would encourage everyone to do. So be grateful. It is so easy to focus on all the negativity out there and all the things that have gone wrong. But take the time to write down 3 things that are good in your life daily and try to be purposeful and text people that made your day. And I actually think when I was going through a really hard time with my work, it was patients that texted me that completely changed my day and made me feel like what we do matters. And so thank you for that. Read a book, listen to music, and here's my shout out to our musical ambassador, Ashley Barron. If you haven't downloaded her music or you haven't listened to her music, she's amazing, and she's another wonderful thing our Scleroderma Foundation really advertises and brings us together around. So good music is important. So let's talk about spiritual health, and this encompasses your perspective, your beliefs beyond your physical day-to-day life. the key concept here is loving yourself unconditionally. Set your bar of expectations for yourself lower. Don't always try to, like I say, go 120 miles per hour. It's okay to go to the speed limit, and it's okay to take a day off and to rest. Engage in reflective practices, prayer, meditation, guided imagery, anything that can help you with that emotional health, because it's really related to being able to process. Be helpful. Consider doing other things or things for others on a daily basis. Our foundation is great about this. Raise your hand if you reached out to someone else in the Scleroderma Foundation when you were having a bad day to help them. I would imagine that's everyone in this room, because that is what this foundation's all about. Supporting others and doing things for others in our community to bring out the best. Singing and laughing out loud daily is actually something that I strongly support. I find this in my patients that have become grandparents, the joy that they have when their little ones are able to do this with them. So be purposeful about taking the time to do things that we learn as children that we forget to do as adults. Try to watch or read uplifting stories. Try not to watch the news. Find and listen to your inner voice, and interact with nature. And this is my youngest son. So the day he graduated from the 8th grade, I had to put him on a plane and move him to Nashville, taking him away from all his friends and his hockey team. And he was quite down and sad about the whole situation. That's me and my Scleroderma Foundation hat. That's my go-to hat that picks me up. And I said, well, why don't we rent canoes, and we are going to go kayak down and see the Country Music Awards. And to watch him go from feeling so despondent and down to so happy was really just this outdoor nature engagement. And so I encourage all of you, if you're having one of those days that everything seems like it's going wrong and it's not going to get better, take some time to try to get outdoors and connect. Live every moment to its fullest and don't take anything for granted. So relationship health is sustaining healthy and supportive relationships in your life. Make your close relationships a priority every day. Employ effective and open communication. And this, again, really means be in the moment. Don't try to pack it all into your day. Take time to be with those that you love, because time with them matters. Don't work on the days you have off. This is to a lot of my doctor friends out there. Be present at home with your family and friends, and attend special events for your family and friends. So this is my whole family. So this is my daughter and son on the top, Maddie and Charlie. And I was on call in Nashville for the Scleroderma Foundation run, and I was really upset about it. And they said, don't worry, we'll go. And I don't know how helpful they were. They probably were not helpful at all. But the fact that they knew it meant so much to me to have my family there, I think really speaks to the fact that they know that this is an important organization to me. And then at the bottom, there's my husband, EJ, and my youngest, Andrew, there. And that's our 2015 walk. It was my first time I was invited to go to Europe to give a talk. And so I was giving a Scleroderma talk. It's kind of same thing. I said, I feel really bad. I'm going to miss this run. Also probably not helpful, but they came and they were a part of the community. And I just really want to tell everyone who's here today, if you're here for a loved one, your presence here matters. And it's really important as a community that we're there for each other. So maintaining your professional and workplace health increases your ability to consistently maintain your work ethic and to help you meet your work expectations. This is part of our identities, our work oftentimes. And so I oftentimes talk to patients who get very anxious about losing the ability to perform certain workplace expectations. And so you can advance your workplace skills in many different ways. You can continue to read within your line of work. You can shift within your expertise. But make sure that you're constantly working with others to find something that's rewarding in your workplace. Don't force yourself to go into work, have it make you anxious and depressed and really grind you down. There's always something else you can do with your expertise. And really reach out to the foundation if you need help, because there's so many good people in the foundation that want to help you thrive. Make sure, though, you set up and maintain appropriate boundaries in your work setting. Don't overdo it. Don't try to compensate if you have limitations. And recognize when your workplace is affecting you both positively and negatively. And most importantly, take the time to thank those who help you at work. And so I'm going to take a moment to pause and thank my University of Utah chronic disease team, in particular these three fantastic ladies. Gloria Ortiz started by checking patients in and doing vital signs. She, after meeting several of our patients, decided she wanted to be a nurse and focus on scleroderma. Nancy Alariga is the one who helped me develop that self-care plan. She would go in and try to meet with every single patient, and she'd come out and say, you missed the most important thing. Do you know that so-and-so is having a grandchild? You didn't even ask about that. And so connecting on all levels, she was really very valuable for understanding the importance of what's important to a patient needs to be important to the doctor. And then lastly, Connie McNeil was my nurse who went and got herself trained in wound care because she wanted to be able to do things in our clinic. And so, again, I feel very grateful for the University of Utah team. So, thank you. So I'm going to pause here to say, I mean, a lot of people say, well, what happened? What happened there? Like, you love that center. That was such a part of your identity. Like, what went wrong and went right? So I wanted to just take a moment to tell a little bit about my story, since we're talking about rebuilding, of how you build a scleroderma center and then you rebuild one. So I started our scleroderma program in 2006. And the reason I started this is there were two pulmonologists, Boaz Markowitz and Nathan Hatton, who had access to a lot of pharmaceutical therapeutics for pulmonary hypertension. And the literature was suggesting these would be effective for Raynaud's phenomenon, but they were too expensive. So I started going to clinic with them, and I said, is there any way you could try to help me get drugs for my patients? And the reason I was interested in this, I was doing a master's program, and I learned that if you're looking at ICD-9 codes and pedigrees of families with scleroderma, the most common trait in families with scleroderma is Raynaud's phenomenon. So there's interstitial lung disease in families and autoimmune disease in families, but it was Raynaud's phenomenon that had the highest risk. And I thought, well, gosh, if we treat Raynaud's phenomenon, maybe we could prevent disease damage, and more importantly, we'd make people feel better. So I'm going to come to clinic, and we're going to do clinic together, and we're going to try this out. And we did this for about 10 years, and it got noticed by a organization that ranks quality in healthcare. And so this Visit grant was given to us in 2016, and that is where that chronic disease clinic was formed. So then I had some money to assemble this team. But what I did is, in the setting of clinic, what we asked the question, well, gosh, if Raynaud's phenomenon is a symptom, does it have, and it seems to have functional consequences, it hurts, can we study scleroderma in the clinical setting, so people come into the clinic and study it in that situation when we're giving time of care, to try to develop a biorepository and try to understand what's happening with this disease. And so we started collecting skin biopsies, and we found that in scleroderma patients, the blood lining cells were really swollen, whereas in Raynaud's patients and healthy controls, they were not. So we said, okay, we need to understand blood vessel function. So then we started doing blood pressure occlusion tests and trying to figure out, could we predict who was going to get a digital ulcer? And so it was good work, and we not only had this award for quality care, but then we were rewarded for our hard work with a big VA Merit Award grant. So the government recognized this and said, wow, this is very meaningful work. Our veterans get Raynaud's, particularly in frostbite exposure. We want you to do more work. And so I had put in a grant, and it received a really high score. And I was like, fantastic, I'm on the top of the world. My program is good quality. I've got a grant to do interesting science. And then we had leadership change. And so I was doing capillaroscopy and sublingual capillaroscopy and developing these cellular models of how you take blood and you can reprogram them into endothelial cells, and you could plate these and test them in all these different circumstances. And the leadership said, this program, now the Visit grant is over, scleroderma doesn't generate a lot of infusion costs. It doesn't not a lot of RVUs. You take way too much time with patients. you're not going to be able to do this anymore since the Vizient grant is over and the VA grant's just over at the VA. So it felt a little bit for me, because I'm here in Utah, the same way a patient tells me about this tornado, it felt like an earthquake. My whole life, what I've built over a long period of time, now is suddenly gone, and it's like 3 people that can say, we don't want to do this program anymore. So and it wasn't just like one shock, it's like 12 aftershocks. It'd be like one thing after another. So that brings us to rebuilding. So I called up the division chief at Vanderbilt, and I said, how many physical days do I need to spend in Nashville? I knew they had a great VA there, and I'll do whatever you want. Just tell me what you want, I'll do it. But how many physical days do I need to spend there to do the work on this grant? She said, how about 2 weeks out of a month? I said, perfect, I'll take it. So I moved the grant to Nashville, and I met, and you can just see in this picture, like the most lovely people. So these are different folks who'd never studied scleroderma, and they said, yeah, we can help these people. We have some things we can do. You're interested in blood flow? Absolutely, I've got biophotonics. And so I have this whole team of people who suddenly want to study scleroderma. But as I went back to Utah, and everybody who is at this lunch is going to know, this is at the corner, or this is from a lunch we had on Foothill Boulevard in Salt Lake City, where I sobbed and said, I need someone to help me with my program. We can't let the University of Utah program go away. And God bless my patients, wrote letters. They went to the head of hospital. They said, can we please keep our scleroderma program? So I was given a 1-year contract. They said, yep, you can be an adjunct for 1 year, and we can still see if you can keep this program going. And the amount of trust and patience and support I received from the Salt Lake City scleroderma community, I can't say enough thank yous for. You are a part of my heart and my soul, and I am very, very grateful for all you did to try to keep our program. And I'll highlight that at the same time, Vanderbilt had noticed that the National Scleroderma Foundation put us up on the website as a center of excellence. And they had this big news story and encouraged everybody to donate to the foundation. And they're like, we are so excited to have a scleroderma program. Everybody should give to this organization. And so it was like, I was like, wow, this is nice. They really want to build a program. And I think that really highlights the importance of institutions working with foundations together to raise awareness and to know the value of taking good care of our patients. So I really shout out to the National Scleroderma Foundation for their help in helping me rebuild a center. And then lastly, just to my colleagues in particular, during this whole time my life was falling apart, I had agreed to be an editor for this journal. And I had to collect like a lot of articles quickly by all the top scleroderma community and put it together and edit these. And I'm going back and forth between 2 centers. And every single one of my colleagues stepped up and wrote me an article. And it all went into a group of this Scleroderma Best Practices to Patient Care book, and actually is one of the things that I am the most proud of. Every single person's article required very minimal editing, so they saved my life on that one. So thank you to my colleagues who wrote for that. And that really brings us kind of to the conclusion of what is a Scleroderma Center of Excellence? Why are you here? Why are you trying to get information? Is you're trying to figure out how to get the best multidisciplinary expert care. And that can include rheumatology, pulmonary, cardiology, gastroenterology, therapy, OT, PT, lymphedema, wound. All of this is so critical to taking care of the whole patient and palliative care. Clinical trials registry options are essential for us to move the field forward. Registries are the way that we can collect unbiased data and just see how people are doing over time. And then a Scleroderma Center of Excellence really going to follow guideline-directed care, and that's really what you're here to learn. Like, what are the guidelines? What is the information I need to know to stay well? And that's what we're trying to do this weekend. We're building on this strong foundation. So we've kind of given you the tools. You're going to do your self-care plan. You're going to optimize your sleep, your exercise, your mood, and your diet. And now we're going to build on it. We're going to hopefully have you learn how and what therapies are coming in the vascular space, antifibrotic space, immuno-based therapies to relieve your symptoms. So really trying to take what information's out there and come up with an individualized treatment decision. And I show this because it's complex, and so it's not simple. It's not, you're not going to go to probably one lecture and say, now I get it all. But it's chipping away at it. It's understanding how do we treat Raynaud's and skin ulcers and pulmonary hypertension and renal crisis and GAVE? How are those vascular therapies and strategies effective? Immune therapies, where are we at with treating skin fibrosis, inflammatory arthritis, inflammatory muscle disease, and lung disease? And with new drugs coming and targeting fibrosis, interstitial lung disease, cardiac arrhythmia, GI tract dysmotility, joint contractures, is there a future here with the latest and greatest? And the Scleroderma Foundation works tirelessly to try to get that information to you. They are constantly reading and trying to get articles out to your physician advisory board, trying to figure out what's good information, what's bad information, do no harm. How do we get good information to our patients so they can make individual treatment decisions? And so you're here to bring it back. You want to come up with a balanced care plan. You want to be able to balance the risks and benefits and kind of understand how that disease damage means disease has happened and the organ is damaged. And if we give you a treatment, it may harm you versus disease activity where there's an opportunity for intervention. And that's a very individualized process. But at least when you're here, you start to understand what are symptoms and how do we go about treating them effectively. Because every visit that you go, when you go back, every visit you have with your physician should help you clarify your goals of care. And I would encourage everyone when you leave to say, okay, I at least should understand what are my scleroderma medications, what side effects can I expect, do I understand what I need to hold these medications, how long will I be on these medications, do I need refills, which is critical because there's nothing more annoying when you have to wait online or wait for the portal. So I always say that the biggest error we usually make in clinic is I think the medical assistants put those refills in and she thinks I've done it. So just remember to ask, do I need refills? That's one tip here. And do I need lab monitoring to keep well on these medications? And then make sure you ask, do I need other things? Do I have screening tests that are due? Do I need therapies or rehabilitation services? Do I need a nutritionist to understand how to optimize my gut health and how to ensure I'm not malnourished? Do I need a social worker, a pain management specialist? And then one of the things we've really tried to do, and it's been really challenging to rebuild this into it, but how do we coordinate appointments to make your life easier? And that's one critical thing because you may not want all your appointments on one day. I have a lot of patients who say, like, it's exhausting. I don't want to do it all in one day. But communicate that. Make sure that your visit structure is working well for you. Because in between, again, you're going to go back to your self-care plan. You're going to go back to your diary. And you're going to make sure you understand what medications are doing for you. Are they having positive effects? You shouldn't be on something if it's not helping you. Have that conversation with the prescribing physician. Keep a blood pressure log and record your exercise routine. Hold yourself accountable. So in the same line you're putting down your blood pressure, what did you do that day to move? Nutrition and weight stability are also critical and commonly missed. So I was very guilty of this, is that you look at the body mass index as part of the vital signs, but not really trending it over time and making sure that weight loss is not dangerous. So even if your physician doesn't ask you, make sure you're talking about your weight. And then lastly, at your follow-up scleroderma care visits, besides bringing your blood pressure log and your medication list to every visit and reviewing those every time, get your copy of your pulmonary function tests, echocardiogram, imaging reports, keep them in a binder. You'd be surprised how many times the patient portal goes down. Actually, after today, none of us are surprised that anything goes down. But keep a hard copy so that you can discuss those and look at comparisons and trends, and ask about clinical trial and registry options. Try to participate in research. Even if you're not eligible for a clinical trial, Be a part of the larger voice. It's important for us to find a cure. Every patient matters. And then one of the things I think is really complicated is everyone sees their rheumatologist and you say, oh, they ask me so many questions that are taking such good care of me. But oftentimes your rheumatologist doesn't have the time to do it all. So make sure you still have your primary care provider working on you with cardiovascular risk reductions, cholesterol screenings, bone health, immunizations, and age-appropriate cancer screening. Have a full team. So in conclusion, make sure you're embracing and contributing to our supportive scleroderma community. We have the ability to make our world very colorful, that full of love and support, and you're in the right place to make that happen, but be a part of it. Contribute, ask questions, and make sure you make a friend this weekend. And before I say thank you, I want you to reframe that concept of that tornado and just shift your perspective. So having scleroderma actually puts you in the center of many people who are loving you and caring for you and are around you and supporting you. So even though it feels sometimes like a whirlwind and too many symptoms and too much going on, focus on the positives of our community. And with that, I want to thank my own family, who's been my support through my journey along the way, and then most of all to the National Scleroderma Foundation. You're all amazing, and you do it with grace and love, and I'm just so honored to be here with all of you. And with that, thank you very much.